Quality Patient Care, Nursing 3805, Session 5A. You know, as nurses, our primary duty is to make sure our patients receive quality care. However, do we really consider the dimensions in which quality is measured? So let's look and see what quality, the definition of quality, and look at some of those dimensions that we measure quality by. In 2004, the Institutes of Medicine considered patient safety as indistinguishable from the delivery of quality health care. In 2003, Hartlow stated that quality is an optimal balance between possibilities realized and a framework of norms and values. Mitchell added that this conceptual definition reflects the fact that quality is an abstraction and does not exist as a discrete entity. Rather, it is constructed based on an interaction among relevant actors who agree about standards, such as norms and values, and their components or their possibilities. So let's look at these dimensions of quality management in which quality is measured. First of all, we have regulatory agencies. One of the ones that comes to mind is the Joint Commission, is our accrediting group standards. Then we have the standards from nursing care from the ANA. We also have clinical practice treatment guidelines that we look at from the Agencies of Healthcare Research and Quality. We have Agencies of Healthcare Administration that we also look at, as well as the Institutes of Medicine of Patient Safety Goals and the standard practices from each healthcare agencies in which we work. So let's take a look at the Joint Commission. Formerly known as JCAHO, is the primary agency for hospital accreditation. Hospitals must meet certain quality standards to pass inspections. They mandate continuous quality improvement and endorses a Plan Do Study Act cycle for process improvement. Joint Commission is a United States-based, not-for-profit organization that accredits over 19,000 healthcare organizations. It got its start in 1951 when it was created by merging the Hospital Standardization Program with the American Colleges of Physicians. It's a major accrediting body for healthcare institutions that are Medicare and Medicaid funded, addresses patient safety issues, and requires error reductions and design of safe patient care processes. There are safety goals that the Joint Commission also outlines, such as improve accuracy of patient identification, improve communication among caregivers, improve safety of medication administration, improve the safety of using infusion pumps, eliminate wrong site, wrong patient, wrong procedure errors, and improve effectiveness of clinical alarm systems. In addition, they want to reduce the risk of healthcare-associated infections, accurately and completely reconcile medication by nurses across the continuum of care for patients, reduce the risk of patient harm resulting from falls, reduce risk of influenza and pneumococcal diseases in institutionalized older adults, implement applicable NPSF and nosocomial infections, as well as requirements for practitioner sites. They also want to reduce surgical fires, encourage active involvement of patients and families in their care, prevent healthcare-associated pressure ulcers, identify safety risks in the patient population, and improve recognition and response to changes in patient conditions. So what the Joint Commission does, it publishes a Sentinel event monthly, and these Sentinel events is an unexpected occurrence involving death or loss of limb or function. So in other words, it sounds a warning of the need for immediate investigation and a response.